our paper titled Role-Related Determinants of Postpartum Depression in Mothers of Hospitalized Neonates. This is the evidence from a multi-center study in Tanzania. As we know, postpartum depression is a common mood disorder that affecting mothers after delivery. Mothers feel symptoms of guilt, loss of interest, insomnia, change in sleep or appetite, and sometimes feeling of hopeless. Postpartum depression affects approximately 1 out of 5 postpartum women worldwide, with high burden frequently reported in low and middle income countries because of socioeconomic stressors, limited mental health services, and health system constraints. But in Tanzania, the burden of PPD is particularly alarming, with reports suggesting that nearly 6 in 10 postpartum women who are newborn baby admitted in NICU experience PPD. This is high prevalence signal critical gap in the support provided to postpartum mothers facing unpredicted circumstances after their neonate are admitted to the NICU. Normally, a mother expects to deliver a normal health baby, but it becomes tremendous worse if she deliver a baby who needs immediate attention in NICU. This can affect, it can increase the vulnerability to postpartum depressive symptoms as the results of impaired mother-to-child bonding. It can increase long hospital stay as well as poor health outcome of the baby. So the previous study investigated only the single factor, for example, perceived social support, basic psychological needs, and the low maternal adaptation. But this multi-center cross-sectional study investigated both three factors are working together. For example, mother needs social support and met psychological need to help her to adapt with a NICU environment or the condition of the baby, despite of the complexity of the medication of the medical treatment receiving a baby. So this study examined the prevalence of role-related factors associated with the PPD among postpartum women with neonate admitted in NICU in Tanzania. We have two objectives. The first one is to determine the prevalence of postpartum depressive symptoms among mothers of hospitalized neonate in NICU. The second one to assess the association between role adaptation, social support, and unmet psychological needs with depressive symptoms among mothers of hospitalized neonates in NICU. This study, as I said, it's a multi-center descriptive cross-sectional study conducted at Amana, Temeke, Sekoture, and Dodoma RRH. And we selected these sites purposefully because of the availability of functional NICU and also the presence of documented admission neonate trends. The study tools was for namely patient health questionnaire, basic psychological needs satisfaction scale, multidimensional scale of perceived social support, and maternal role adaptation scale. And the study used the consecutive sampling to collect data and analyzed by using descriptive and inferential statistics, which was used to organize, summarize, and to draw the conclusion from the sample population. But the study including mothers who had neonate patient in NICU following cesarean section and spontaneous vertex delivery, and also excluded mothers who had mental disability that can hinder communication during data collection process. And this study got ethical ethical proof from Shania, Department of Nursing Research, and also from the National Institute for Medical Research in Tanzania. These are the results. As you can see here, the total of 466 women participated in the study, and we concluded that 61% of women in Tanzania are suffering from postpartum depressive symptoms. As you see this is the figure showing the prevalence of postpartum depression across the study site. As you see here, here is the overall of the prevalence of postpartum depression. As you see here, there is showing Seketura RRH, Dodoma RRH, Amana, and Temeke. This is showing how the study concluded that the low mean score of role adaptation, social support, and psychological needs was associated with depressive symptoms. Now, the study concluded that nurses need to include nursing care plan to mothers who are caring their neonates in NICU. The study highlights a critical high burden of the postpartum depression among mothers of NICU admitted neonates, underscoring the need for routine mental health screening, early identification, and timely psychosocial support within neonatal care settings. And also, the study concluded that there is the need of integrating maternal mental health services into NICU care is very essential to improve both maternal well-being and neonatal outcomes. A prevalence of 61% indicates that postpartum depression is extremely common among mothers with hospitalized neonate in NICU, far exceeding rate typically reported in the general population. This suggests that having a newborn in intensive care unit is a significant psychological stressor that substantially increases the risk of maternal mental health problems. Our recommendation is the first one, routine screening and early detection of mothers who are suffering with postpartum depression. Integration of maternal mental health service into NICU care is very important. Immediate psychosocial support to these mothers to help them to cope with uh, with the NICU, with the neonatal, with their neonates condition is very mandatory. Family and partner involvement, for example, to educate partners and family members about postpartum depression and involve them in care discussion so that mothers receive strong emotion and practical support at home. Peer support programs is very important. For example, to facilitate support groups for mothers with NICU babies, share experience, often reduce isolation, and normalize emotional response. Also, training for healthcare providers, for example, NICU staff should be trained to recognize signs of maternal distress, communicate empathetically, and refer mothers appropriate rather than focusing solely on the infant. This is our acknowledgement. Thank you for your attention.